Assalamu alaikum, everyone. Welcome back to another episode of the Medical Talk. Today we have with us Dr. Zeb Saeed. Dr. Zeb is currently working as an endocrinologist, and I'm very excited to have her here today with us. Thank you so much for joining us, Dr. Zeb.
Assalamu alaikum, everyone. Yes, it's wonderful to be here. It's been 10 years since I was in your shoes. And as a med student, I'm excited to share my insights, and I'm going to speak from the heart and say like it is.
Thank you for coming. We usually start by talking, what was your early life like, and where were you born and raised, and what was your early education like?
So I was born in a very small town in Pakistan called Kasur, which is an hour drive from Lahore. I was born at home without even the help of a doctor, how it used to be back in the day. And I moved to Lahore. My parents moved us when we were 3.5, 4 years old, mostly for our education. I did all my formative years in Lahore. I did my O levels at convent, and my A levels at LGS, and then I went to Aga Khan in 2007. I came to the US for my postgraduate training in 2014.
Why did you decide to do medicine? What were some of the factors that contributed towards that decision?
So when I was growing up, that's a great question. And that's something for those of you who are applying for residency is something that you should have at the back of your pocket, because you're going to be asked this question a lot in the interviews. So I did not know for the longest time I wanted to do medicine. There are no doctors in my family from either my mom's side or my dad's side. And nobody since then has become a doctor. So clearly I didn't influence a lot of my younger cousins and siblings to go into this. But one of my early childhood memories is my dad was only 46 when he had a massive heart attack and needed coronary angio bypass grafting in Lahore. I was in 5th grade at that time. And it was 3 days before my birthday. So I vividly remember him in our living room, clutching his chest, and then taking to the hospital, finding out that he had acute MI, giving him streptokinase, and then needing to undergo cabbage. So I remember feeling this helplessness more than anything as the daughter. And I was like, I wish I could be the one taking care of him. And I think that was a big driving factor, which I didn't even realize that was a driving factor until into my med school. And I'll get into how that transpired. The one thing I did know growing in my formative years was that I was really good at physics, biology, and chemistry. Those were my good subjects. I really, really liked physics, but the kind of what I wanted to do, my parents were very open in me going to any place remote. I really liked accounting, and chartered accounting in UK is expensive. And I was just really good at biology. And then with that and my want to make my dad somehow better, resulted in me going through med school, and never regretted since. During med school, my dad had a few health scares too. Families from Lahore, and my med school was in Karachi, and my dad was living in Karachi at that time. So I was the really only sole caregiver for my dad at that time. And I think that just further cemented my belief that this is what I want to be doing.
I think that some factors in your life, they play a very big role in where you are right now, and you don't realize, but when you look back, you realize that this was the reason that you came to med school or decided to do this.
Yeah, absolutely. Yeah.
So what was your medical school experience like, and why did you decide to move to the US for practice?
So like I said, when I first went, I had no mentors particularly who were doctors really up until I went to med school, who I could, look forward to, look up to, or know what really being a doctor is like. So I was kind of in the dark. I went to med school genuinely thinking that you finish med school and then you start practice. Like, I did not know there was something called postgraduate training, residency, fellowship, none of that. And you start in Pakistan, we start med school when we're not even 18 sometimes. So we're really kids, just going into this big flooring on our own.
Yeah.
So it was there when I first found out about USMLEs and what people do and what they don't do. So a lot of it was by osmosis, because a lot of people from my med school do come to the US for training. Yeah. For me, it was the kind of training that I had done in Aga Khan. It's very similar to how it is taught in the US. The other reason was that I have always, even as a med student, I was interested in the education aspect and the research aspect. And I know the opportunities that US had were boundless. Lastly, it was a well-worn pathway. So I feel like there was a known, there's always comfort in what's known. So I kind of knew what I needed to do at that time to match in the US, and that just made my decision easier.
That's great. So why did you choose internal medicine, and how do you think that medical students who are in that phase of their lives right now can rule out specialties and choose the one that they really want to do?
I think the way med schools are, especially when I compare to med schools in the US to Pakistan, in some ways we're better geared to answering that question than even the US medical students. 3 years of clinical, where in the US it's 2 and 2. So in those 3 years, you have 3 months, at least I had a total of 4 months of internal medicine, 3 months of peds, 3 months of surgery, 3 months of OBGYN. So a lot of those exposures, and then family medicine. So a few things that I knew right off the bat. I hated being in the OR, as simple as that. So for me, surgery was out of the picture from the first day. I love kids and I have kids of my own, but I did not like taking care of sick kids. And I was also the pressure that comes, the fact that they cannot really be a reliable historian, similarly OBGYN. More than anything, what I really liked about internal medicine was it kind of did everything that I liked about medicine, right? It has that pathophysiology that we learned in the first 2 years, or what we learn even in our O-levels, A-levels in biology, and how the human body works. I really, really enjoyed it. I loved my residency, and I loved every single rotation I was in my residency. So that decision about doing internal medicine was easy. Yeah. The hard decision was once in internal medicine to figure out what, if anything, I want to self-specialize in.
When you're talking about the internal medicine residency, what is the work-life balance like?
Yeah, so it's very varied depending on the program that you're in. And depending on the part of this US, so which state you're in. So I did my internal medicine residency at Indiana University in 2014. So a large program, we have 35 residents categorically. So the work-life balance was not bad in my mind. So there are months when you're on the things where it can be 80 hours a week. Having said that, even from when I was a resident in 2014 to now, things have drastically changed, and there has been a lot of initiative on resident and trainee wellness, which has resulted in a cap in the number of patients that you're seeing. There is a cap in the number of hours continuously that you're in the hospital. There's a decrease in the amount of the 30-hour shifts, which in Indiana University we don't even have anymore, which we used to when I was a resident. So all these initiatives, and at the end of the day, I mean, all the residency programs in the US are accredited by ACGME, which looks at these things, but looks at work hour violations, but looks at resident wellness and surveys residents. Yeah. It wasn't hard for us. The hardest part was, so I couple smashed. We were in med school, went to the same med school together. We married soon before our residency when we came here. So we married 3 months before we started residency. Is that I had twins at the start of second year of residency. So for me, that was the hardest part, is having no support. Families all in Pakistan, and so is his family. But taking care of 2 newborns at the same time while being second year residents and having overnight calls. So it was a little tough, but it was all worth it. And my girls are now 7 years old, and it feels like not that big a deal.
That must be hard, managing 2 girls with the residency. So after your residency finished, as you mentioned, that it's very difficult to decide what subspecialty you want to do. So how did you decide that?
I think it's a very layered question. And I think it's very individualized, and it's not just what you want to do, but also the practicality. So I'll tell you my story, and then I'll also other things that I think people should think about before considering. So when I started, so my med school, my mentors were, most research that I did was in nephrology. So I had published 4 papers together. So everything was like, oh, I want to be a nephrologist. I started my first month in nephrology, and I really loved it, except that I realized that the part that I love in nephrology, acute kidney injury and acute tubular necrosis, which is a very small percentage of what my life be like if I want to do nephrology. So that was a little bit further down. I did also realize that every single elective that I did, I enjoyed it. I loved GI, I loved cardiology. And really, for a long portion, I wanted to do heart failure. So I wanted to do cardiology and then subspecialize in heart failure. So I had research in that, and I had mentors in that, and then I had my daughters. And I remember even being on bed rest with my daughters because I had preeclampsia and still in the hospital on bed rest working on my research because I was like, yep, as soon as they're out, I'm going to go back and be fully into doing this. And then I became a mom. And then I realized my priorities had changed. So, which is what I mean is like you look at the whole picture, not just what you want. So my husband wanted to do home critical care. I really didn't think that that was the life that I wanted to live, where I would be doing 24-hour calls, being called to the hospital whenever there is an emergency. And that just completely changed me. So it was in my second year, if I wanted to do fellowship, which I did, I know I want to, and I'll discuss why in just a minute. I had to make the decision within 6 months or so. So I really went back to the drawing board and said, okay, so I liked nephrology and I liked cardiology. What is the things that I liked about them? Because I really liked heart failure. That was particularly the only thing in cardiology I really liked. And then I realized what I liked was the pathophys of both of them. So in heart failure, it's one of the most, we learn about the Sterling's curve and all of that. So those were the things that I really liked about it. And in nephrology, it was similar to that. So with that, I plugged in my equation something with the good lifestyle that I could with other things that I want to do in my life, and also have a research position and also do something in education, and endocrinology seemed like the obvious choice. So I was not even destined to have an endocrinology elective in my second year. It wasn't in my schedule. And I asked my then program director to be off to get a month. And I got a month in endocrinology 5 months before the applications were due. And I loved it. It was exactly what I wanted. I loved the different feedback pathways, which are inherent to endocrinology. I loved the aspect of continuity of care and me establishing relationships with patients. And I love that my work days ends at a certain time and there's certainty to my schedule. And then I've never looked back, and I love that I'm an endocrinologist. It's exactly what me and my family needs. Yeah.
Endocrinology, I find it really interesting as well. It combines the pathophysiology and the pathways and all the concepts that you learn in med school. I think it's really interesting.
Yeah. One thing I want to say about one other thing that was a consideration that I do think for people coming from Pakistan should have a consideration is the visa status. So I think that is often a consideration it was for us. So there's two schools of thoughts in there. Some people want to just get done with their waiver. And then, because it's easier if you do a waiver in a primary care, or so for those of our med students who are not familiar with waiver, let me just quickly go back and just quickly mention. So in order to come to the US for residency, of course, you need to be allowed in the US on a visa, or unless you are a permanent resident or you hold citizenship in the US, which most of us don't. So most of the people and most of the programs offer what is called a J1 waiver.
Yeah.
Do you think that's something relevant to talk about to your?
I think a lot of people do not know about this, and it's a very big confusion when people are talking about visas.
So most people can't come on a visa called a J1 visa, which is really an exchange visa. So the whole premise of the J1 visa, which is granted by the ACFMG, which is the main community, which is the main body that oversees international medical students coming for postgraduate training in the US. The whole premise is you come here for your training and then you go back to your country for at least 2 years. Okay. The problem with that is if you go back to your home country, which is Pakistan for us, for a couple of years, it's hard to come back and find a job because they're more likely to look from within than to look from an international candidate. Mm-hmm. So in order to start a job after training, you have to do what is called a waiver. In other words, you have to have some way of waiving the 2-hour requirement, which is to return to the home country. 90 or so % of probably people do something called Conrad 30 waiver, which is every state has 30 or so spots where doctors can do work in an underrepresented area. So an area where patients belong to an low poverty line or underrepresented minority. And once they work there for 3 years, then the waiver is waived off, and then they can apply for permanent residency, which is what we call the green card. Because every state has its own rules about it, but generally speaking, a lot of states prefer primary care or hospitalist applications because they're less sought out of than specialists. So a lot of people that I know from Pakistan, India, other countries, they prefer to finish doing their waiver before doing fellowship, so that then they have their green card and they might be more competitive for fellowship. Having said that, my school of thought was I wanted to get it all done with because I wanted to do it when I'm still young and have the energy, and then just finish all my training at least, and then look for a waiver and then switch to a job. There are other ways, which this is not the topic of the discussion today, but there are other ways that you can get rid of the J1 waiver status and waive it, but most of them, they do it this way. So oftentimes this is a reason why we have folks who come here and they wait for 3-4 years before applying for fellowship.
I think there are a lot of issues when it comes to Pakistani medical students and Pakistani graduates practicing in the US with respect to the visas.
Yes, that is true. There are bodies which help with that. There is a body called APNA, which is All Pakistan. I'm going to say it wrong, but physicians for North America, I think.
It's really
so they do help with that. So when we were coming for electives, my visa came on time, but my husband's visa came in, like it went for processing. So it came in a couple of months. So he had to complete, because in Aga Khan, in our last year, we have 3 months elective where we can do anywhere in the world. So I did it in the US at that time. But he did some more electives after graduation because of the fact that he could only do a month and a half before because of the delay in the visa, which I understand is a big concern, and it's a big, it causes a lot of stress to our med students.
You applied for the couples match. What was that experience like? Did you face any problems during that entire process?
For us, I'll be honest, it was a really nice experience, and we had a very good experience about it. So what I did on my ERAS application from the get-go, say that I was in a couples match, gotten all kinds of advice from our superiors who had done this before us. Some said do it, some said no, don't do it, because then they won't even call you. I think it's important to have your discussion with your partner and your spouse ahead of time. So for us, it was really important that we go to the same city, and we weren't that was something that we weren't willing to compromise on. So for us, both of us didn't want the option of matching, but matching somewhere separate. We wanted to declare it. Now, if you are applying for a couples match where you would be okay with the option of doing long distance for 3 years, then perhaps it's not that important. And we see people do that. We had a few places where, for instance, he got a call and I didn't, or vice versa, where we just reached out. We even had a couple of places where one of us went first, and the other person had even gotten a rejection. And after we went, the other person got an offer. So it really worked for us. And then when it was coming for the rank order list, we just looked for places which are at least in the same city, at least in the same state, and finished out the entire 30, I think is what you get, the possible combinations. We finished it all out. The other thing that we did was apply to larger programs which take more residents, because they were more willing to probably take 2 or more, right? So that's why the other thing that we did was also look at the previous match lists, because it kind of tells us, well, which medical schools are and which residency programs are more familiar with our med school, and so know a little bit about us, and that I think did help. Now, for people who are going through the match now, it is getting more and more difficult. I completely sympathize with you, because when I was doing, USMLE, and really had a lot of say in that. And so you could really ace your exams, and that mattered more. Now, as we all know, USMLE step 1 is pass and fail, which inadvertently, the reasoning behind that was very pure. And I think I understand that standardized exams may be favoring some people more the other and does not really reflect holistically what an applicant is capable of. However, for IMGs, it was a low-hanging fruit, something that was in our control. That was something that we could really perform well. And with that going, it has inadvertently affected us. The other thing with the step CS going away also in many ways may have affected us. The third thing is with COVID, a lot of places shut down for electives, and a lot of people are scrambling for observerships. And even that, it's sometimes hard and sometimes is really a lot of money. I did not have to pay. I've seen the observerships. I know how much people are paying for that. I didn't have to pay any of that. So I really, really feel for it. I do still think observerships matter. So it is important, I think, for anyone wanting to come to the US to make sure that whatever they can do to have at least one or more clinical experience in the US, ideally an elective, but if that's not possible, to do an observership. There is, I think the listeners might already be aware, but there is an American Medical Association website which has all the observerships listed. It has quite a bit. It has like 26 pages worth of observerships which are being offered in the US through their program. Every place has its own stipulations, its own monetary value with that. The other thing that helps is having a community of your med school or others, either on social media or WhatsApp, and just figuring out what other people are doing, because it really helped us. I did a research elective in my second year of med school, and that was really through one of my seniors having had done that in the same place before. And similarly was my clinical elective, so it does help. But I fully sympathize with our listeners and our med students that it is getting harder and harder, and I wish there was an easier way than what it is becoming now.
I want to talk a little bit about how, when you aim to go to the US, there is this element of the American dream we talk about, where everyone watches the US hospitals and the lifestyle over there in TV shows. And they think that once you match in a program in the US, everything will be perfect. So what are your thoughts regarding that?
That is an awesome question, because I have a lot of thoughts about it. And I think it's a lot of how we're brought up in Pakistan, right? So we're brought up saying, just pass your final exams, everything would be perfect. Then just all A's in your A levels, find a good med school, and then just graduate, and then just USMLEs, and then just that, I think, is such a wrong misconception, because life is life. If anyone now asks me, what was my best and most carefree part, was my med school. Enjoy your life at what it is. Yeah. All these hardships, they'll be different. There are going to be some things which are going to be easier. You'll have more monetary, perhaps, satisfaction. You'll have less angst about it, but then you'll have kids. And then you'll have to worry about mortgage. So life is life. And it's something that I try to tell my kids. What you think right now are problems are going to look like, that was nothing compared to what I have right now.
Yeah.
So please enjoy your life while you're going through this, because this is all part of life. You're always going to have obstacles. There's always going to be hardships. And in the meantime, while you're doing that, it's important to enjoy. So the American dream, there are certain things absolutely that I love, right? I love that if you work hard here, you can do what you want to. So right now, I'm 3 years out of my fellowship, but I do a little bit of clinical. I do 30 to 40% clinical and see patients, but others, I'm literally in my dream job. In medical education world, I am an associate clerkship director for one of the biggest med schools in Pakistan, in the US. So Indiana University, for their clerkship, I'm an associate clerkship director. I am the key clinical educator for the entire division of endocrinology. Next year, I'll be associate program director for our fellowship. I am a part of a lot of NIH grants, which is paying for some of my salary. So yes, on paper, it's like, oh, she has it, she got it. Yes, but still life is life. You have different struggles, you have different responsibilities. Yes, it is better in some ways, but it's harder in other ways. So enjoy your life as it is right now. I'm not that old, but still I would be like that.
I think, as you mentioned, that it stems a lot from our culture. I think everyone has heard this, but एक दफा medical school में घुस जाओ, doctor बन के ही निकलोगे, and everything would be perfect.
I know. I'm telling you, sister, our parents kind of, if they didn't do that, we wouldn't do the things. Like, I think that's our parents' way of making sure we're on the right track.
Yeah.
But no, enjoy your life. Enjoy this carefree life in med school, because it's going to get more complicated.
Thank you for mentioning that. I think that's a big misconception that all of us have. And I think we should be very realistic when we are thinking about our future.
One other thing is there are going to be failures, right? So, I mean, we also had quite a few people that we knew of who didn't match, or, but they didn't give up. We have people who matched on their third try. We have people who went to Doha. We have people who did other things, and they're doing awesome in life. Like, we just had earlier this month, September, our 10-year med school reunion in Chicago, which was a blast. But like, everyone is doing something now. Everyone is where they were in, where God intended, where Allah intended them to be. So just enjoy this life as with all the struggles, because everyone struggles in one way or the other, and that's just life.
This is a question I ask most of my guests, and I have gotten a lot of interesting answers. That how do you see medicine 50 years from now?
So that's a very good question. How do I see medicine 50 years from now? So a few things that will change. So let's talk about just the patient care itself. I think the future is in precision medicine. What we really know now about patient care, that, and we keep on evolving, right? As doctors, we're lifelong learners. We're always inquisitive. We're always curious. Is we know that even for blood pressure medicines, what works for Anusha may not work for Zeb. And that's what is precision medicine all about. Is we do that for cancer, right? We look at pathology for cancer. We look at the molecular markers of the pathology, and then we decide directed therapies based on the genetics. That's what I see the medicine of the future for everything. That everyone will in their pocket have a card which is going to say, for Zeb Saeed, hydrochlorothiazide will work, April wouldn't work because that's her, mutations, that's her genetic makeup. So we're already working on precision medicine for diabetes, for example. So one of the biggest things that I see in patient care is going to be that. The other thing that I think about is going to be more and more use of machine learning and artificial intelligence. We're already doing some of that, for example, in radiology, and just finding out ahead of time if something is worse, malignant versus benign. So I think artificial intelligence is going to keep on growing. The third thing, I mean, there has been a lot of mid-level providers which are nurse practitioner, physician assistants. I do think they're here to stay. So I think that's going to be a change with people considering whether they want to become a doctor or they want to do become mid-level providers. Fourth thing I see is hopefully the way that I'm seeing with med school and just generally the culture of medicine is also going to be making sure wellness is a big part of it. So I do see where, it's always like that. When I was a resident, my faculty used to say, you don't know what residency was. We used to stay so long. And I feel like I'm an old person because for my med students, you don't know, we did 30 hours and went home to crying babies. So I think that is going to change just the culture around medicine, that's not okay. Just because it was done in the past doesn't mean it's okay. We still need to be if a lot of people are starting residency in their late 20s or even 30s, well, they still need to have a life. They're still going to have kids. I think that culture is also going to change.
I think the future of medicine will be really interesting, and I hope that we are here to see that.
If it was up to me, I would love that idea of everyone having like a pocket card where it's just like, this is my genetic makeup. For blood pressure, this works. For like, these are the things that you should consider about before putting me on something. So, because I mean, right now it's trial and error for a lot of our things, right? We try something, and even for diabetes, and we see for GLP-1 receptor agonists for diabetes, for some people it works really well, for others not. Why is that? So
I think that brings us to the end of our conversation. Thank you so much for joining us. It was actually a very insightful and very helpful conversation, and I hope that we can have you again on the podcast. Thank you so much for coming.
Absolutely. I was happy to share my insights, and I'm excited to see what future of our med students from Pakistan hold. So yeah.